Have you ever wondered what it's like to sit in on a magazine editorial meeting? Well, this is your chance. You're listening to Salt Lake Speaks, a monthly podcast where our editors, writers, and staff dig deeper into stories, chat with newsmakers, and talk amongst ourselves about arts, culture, food, music, politics, or whatever else might strike our fancy. After all, we are Utah's biggest fans.
Hi, this is Salt Lake Speaks from Salt Lake Magazine. I'm Glenn Warchel, managing editor of Salt Lake Magazine. I'm talking today with Salt Lake County Mayor Ben McAdams, and we're going to discuss homelessness, where we are now, but more about where do we go from here, referring, of course, to the Rio Grande operation that has been a heavy hand of law enforcement rather than treatment. And today I'm welcoming Mayor Ben McAdams, who, among other things, spent 2 nights on the streets with the homeless, that I think gives him a very unique perspective on all of this. Mayor McAdams, do you have any concerns with Operation Rio Grande?
You know, I think we really got to the point over the last few years, and it really exploded this summer, where we know the long-term solution to some of the challenges we think with homelessness is treatment, whether it's drug treatment, job training, housing. Those are the things that we have to invest in for the long term if we want to make a difference. We did get to the point where there was this public safety crisis that was overshadowing everything we were trying to do down there. So hence Operation Rio Grande, where the state and Salt Lake City, now Salt Lake County is more the human services component of it. We don't have a law enforcement. There's a unified police department that provides police services, but not in Salt Lake City. So the law enforcement part of it was a Salt Lake City and state of Utah endeavor, and Salt Lake County is on the human services end of it. I did have some concerns with Operation Rio Grande, although I am a supporter, I think, because it was the realities of what we were dealing with the major public safety crisis. But we know that if we want to make a sustainable difference, if we want to make the situation better in the long term, what we need to do is to provide treatment. We need to provide drug treatment, behavioral health treatment, mental health, access to jobs and job training. Those are the things that are going to make it better for the long term. The Operation Rio Grande really is a short-term effort to address the lawlessness and the public safety challenges we see in the Rio Grande. And I think we got to the point that things were so bad down there, the lawlessness, it really was anarchy in the Rio Grande area, that we needed to do something, and hence Operation Rio Grande was born.
And for a second here, I want to put the listeners into the Wayback Machine and go way back to this spring, the previous spring, when this all began to roll out, what was called the new model, and you were behind that, and it was about treatment, housing, and getting a segment of our population that is seriously struggling back on path in a compassionate way. We moved forward from that, and now we're in the midst of Operation Rio Grande, which by its very nature is not sustainable.
Right.
And has anything changed vis-a-vis the new model based on what's happened? Public support still there?
Yeah, I think so. I think it's worth recognizing the new model hasn't been scrapped. We're still moving ahead with this new model of homeless services, one that's focused more on treatment by addressing the root causes of homelessness rather than just band-aiding it with a meal and a bed, but getting to the root causes of what's causing someone's crisis. That plan is still in place, and that's moving forward. I feel like we have even stronger support from the state and Salt Lake City for that plan now, today, than we did before, as they've gotten into the problem and seen it. You know, we really are to the point, we've put pencil to paper to see that we cannot afford to incarcerate our way out of this problem. And we're seeing that with Operation Rio Grande. We needed to, we did need to address some of the criminal issues, public safety issues in the Rio Grande, but there was no way that we could we can't afford to incarcerate our way out of it. There aren't enough jail beds in the state. There's not enough money in the state and the county and the city budget to lock up all of the people for minor offenses, or even offenses related to an addiction or a behavioral health issue. We can't afford it, and we've costed those out, and it's not affordable. So I think it's brought people around full circle to the new model, and that we really, if we want to make a sustainable impact, we have to help people to address the root causes of their challenges. And I think that's where we are. So Operation Rio Grande, it started with phase 1, which was very much law enforcement focused, but phase 2 is starting to move forward. And phase 2 is something that I've been more intimately involved with, and that is bringing online the treatment beds and the drug treatment, behavioral health treatment. That's going to take some time to spin it up. You can't just flip a switch and have counselors and therapists and drug treatment programs up overnight. So what we've seen is it's going to come online over the next 6 to 8 months. We have almost 40 beds that will be made available this week, early September. And then over the next 6 to 8 months, we're going to have a total of 200 new treatment beds that will be brought online with state and county funding. And that's really going to start, I think, the sustainable change that we need in the system to start getting people, helping them to get better.
One of the things that I have picked up in the media and from people that are broadly involved as citizens in the city is that there seems to be a lack of appetite for, as you pointed out, long-term solutions. This isn't going to be simple. Even the Bible tells us that the poor will be with us, which I'm not sure was the most helpful statement. but we're moving forward with this, but a lot of people seem to be very satisfied with the police involvement in Rio Grande. Is there an appetite? Has the citizens of the county hit a sort of compassion exhaustion level where they just want it fixed now?
I think there was some compassion exhaustion, if you want to put it that way, with people are compassionate, and we see the needs of really, really compelling needs in our community. But what I think a lot of people started to see is it was overshadowed by the drug trade. And you had, over the summer, some very high profile, a national baseball player who was assaulted in town. You had a homeless woman who was hit by a car and assaults. People were being killed. We had a series of 3 or 4 murders in early July in the Rio Grande area, and people saw that. And there was outrage, and I have to admit that I feel the compassion, but I also do feel the outrage. And some of it's the outrage for an area of our capital city where you can't go and feel safe, or members of the public can't go and feel safe, or businesses in that area, or residents in that area don't feel safe. I feel some outrage for that. I think that outrage is also balanced by compassion. We have a pretty good homeless services system in Utah, and yet we're telling those who are vulnerable to come to this area that's the least safe area in the state to come to receive your services. And so I think even some of the law enforcement efforts that we've seen in Operation Rio Grande can be motivated, but from a place of compassion as well. I think it is motivated by some outrage, but motivated by a place of compassion that we're asking our vulnerable to come to this place. You're struggling to overcome an addiction. Well, we've got treatment services for you, but to get them, you've got to walk through places where you're being offered drugs every 20 feet and come there and get help. That's not a compassionate thing to do either.
One of the things about Operation Rio Grande that I saw from your point of view might be helpful is, up until Operation Rio Grande, the state was sort of a dispassionate observer in this chaotic situation, this crisis, to say the least. Now we have the lieutenant governor as a sort of czar of homelessness, coordinating things. We have the extremely powerful Speaker of the House, Greg Hughes, coming in and getting involved. And although he seems to like the short-term solutions better than the long-term, but your programs desperately needed state help through Medicaid and other things to actually function and work. Do you think in a way you've perhaps trapped the state into, they're in it now?
Yeah, I was so happy to see that the state was willing to get involved. Greg Hughes, we don't always see eye to eye, but one of the things I love about him is he jumps into problems with both feet. Now, I've been in cases where that's not a good thing, where he jumps in with both feet. But in this case, on homelessness, just because we have different perspectives on things. But in this case, I think we share a perspective that something has to be done about the Rio Grande, and he has jumped in with both feet, and I appreciate that. And he is the Speaker of the House, and he is powerful. He's also the legislative branch, and so it's hard for the legislative branch of the state to bring the State Department of Public Safety, the state Department of Human Services or Workforce Services to the table. And so to finally have the attention of the governor and the lieutenant governor focusing on this as well is making a lot of difference to us. You know, the lieutenant governor by statute is the chair of the statewide homelessness coordinating committee, and that's a role that he's held for the entire time that he's been in office. And we've been waving the red flag saying this is not something that we can tackle alone. These people are coming from across the state. In fact, they're coming a lot of times due to decisions that have been made at the state level, like the Justice Reinvestment Initiative, where the state said we're going to incarcerate fewer people and put them in treatment. And so they changed the laws so that fewer people were sent to prison, but then they didn't pass Medicaid expansion. So these people were sent from state prison to the streets of Salt Lake City with no treatment option. And so I think they recognized that some of what we were dealing with in Salt Lake City and Salt Lake County was a consequence of decisions that were made at the state level, and there was some responsibility for them to step in. So it was incredibly refreshing to have them step in and really commit fully to addressing these problems. I think the only thing that could have happened better is to maybe have had that commitment sooner. So we could have, you know, a lot of this stuff could have been executed more seamlessly if we had started sooner. But I'm not going to let perfect be the enemy good, or beggars can't be choosers. They're at the table now, and I'm happy to have them at the table working with us.
Do you think, and to go back to the speaker being involved and the things you mentioned about sort of the legislature perhaps not quite getting it about treatment versus incarceration, do you think that the speaker is going to embrace long-term, the necessity of long-term by pushing for funding wherever possible? Because he was one of the Medicaid roadblocks.
Yeah, I mean, he I think very proudly will say he helped to stop Medicaid expansion. And considers that one of his accomplishments. He knows that, and I see that differently than him, that I think that was a mistake to pass on that Medicaid expansion. But it's been refreshing for me to hear the Speaker of the House in press conferences and other places say, if we do not expand treatment options, then JRI, the Justice Reinvestment Initiative, is dead. And that's this view that we have at the state and the county level that simply locking up people and warehousing them and throwing away the key is expensive and not sustainable, that we need to treat them. That philosophy started with the Justice Reinvestment Initiative, but when treatment didn't come online, I've been saying for a couple of years, as have many other people saying, if we don't have access to treatment, then JRI will fail. And JRI is failing, and I think that's what we see in the Rio Grande, is the failure of the Justice Reinvestment Initiative to have adequate treatment resources. But to hear the Speaker of the House saying that, I think says that he gets it, and I think he did get it before, but I think he gets the magnitude of the challenges we're facing now and the urgency to bring those treatment resources online, such that we've spent a lot of time over the last month in the context of Operation Rio Grande talking about how we can bring, where can we find common ground on expanding access to Medicaid? How quickly can we bring these options to the table and start bringing these resources to the table? And we have a proposal right now that we're working on that would bring about $100 million of treatment and coverage to people in need. It'll cover almost 9,000 people in need of the poorest of the poor. So it's not full Medicaid expansion, which is what I would prefer, but full Medicaid expansion would bring about $300 million to treatment and cover everybody in poverty. The plan that we've convened around, or there's some consensus around right now, is about $100 million, so it's about the third the size of that. But it will make a visible and measurable impact on what we're trying to do for treatment for those who are in the criminal justice system.
If I can turn to a couple of things that had more personal impact on you. One of them is that as the resource center placement process rolled out this summer, and you can't see it as anything but sort of a fiasco in some cases, we saw some very ugly behavior by residents. I'm thinking of just one example, and I went to several of the meetings, but the Draper meeting, in which a homeless man was shouted down by residents for attempting to thank care workers and political leaders for the things they had done. How did that strike you? Was that Was that what you expected to see, or did you see a side to your community that you didn't think was there?
I think that was disappointing. I want to say that I certainly understand people having concerns. I think they look at what we see in the Rio Grande right now, and they can only imagine that it's going to be similar to that in their neighborhood. And who would want the chaos that we see in Rio Grande in anybody's backyard? So I think I can understand that. I think I try to reassure them that it's going to be different, that it's a different model entirely, that and I, with all confidence, can say that this will be very different, the new model. But people, and people would say, how can we know that it's going to be different? Why don't we see it elsewhere? And I would point out that there actually are providers in Salt Lake City who are following this resource center model. The VOA, Volunteers of America Youth Resource Center, the YWCA Women's Resource Center in Salt Lake City. And people say, well, why aren't we aware of that? And I say, well, that's exactly the point, because they work. They don't have 1,000 people out in front committing crimes and openly injecting drugs into their bodies. So these providers are out there, and they do work. They're in our community, and that's the new model. But I can certainly understand, have some empathy for people's fears and concerns about what a new resource center might mean for their community. At the same time, reassure them that it's going to look very different. But that shelter site selection, there were two processes I know you're aware of, but the first one led by Salt Lake City, where they chose 4 locations that were announced in December, and then when a couple of those locations didn't move forward.
I'm impressed you're able to keep track of those numbers, because it was 2, then 4.
It was, yeah. Originally we had recommended 2. The city wanted to go up to 4, and so they did. And then 2 of those sites didn't pan out, and so the state legislature came to me and asked me to lead. We were going to settle on 3 locations, and I'm sure your listeners are now confused about the numbers too. And asked and charged me, actually wrote a law putting me, tasking me with selecting a location by March 30th. So it gave me about 5 weeks to go out and find a location, get it under contract. I felt strongly that I wanted to do, that it was important to do a public process with that, knowing that it wasn't going to be fun and it wasn't going to be pretty, but that we needed to solicit public input on this. And so we put together a public input process and went forward and did that. And, no surprise, I said, look, we're not going to, with this public input process, we're not going to get unanimity. We may not even get support, but what we can do is make a well-informed decision and find out what the flaws are in a certain site and make a well-informed decision when we finally decide upon a location. So it was, I think, I wasn't surprised that it was ugly, and we had a lot of public pushback. We knew that would happen, but the public process, a public engagement process is never, you don't do it because it's pretty, you do it because you want to hear what the public will have to say about something. But I think the Draper one in particular got especially ugly, and it was disappointing. I think that there were many people in Draper who saw that the prison was being moved out of their community, that there was an ethic and culture of volunteerism in Draper, and that there might be people there who'd be willing to support a shelter for women and children. So, I did a town hall together with the mayor of Draper to solicit input from the public there. And, unfortunately, there were people who were not open to even the idea of what this might be anywhere within the boundaries of Draper, and I think that was disappointing.
Well, I remember when the process back when I said in the Wayback Machine started, former mayor, Salt Lake mayor, city mayor, Palmer DePaulis.
That's way back. Yeah.
Said, you got to make your luck, and the way you make your luck is to take it to the public, take it to the public, take it to the public, until finally they say they've heard, and they're still not going to be happy, but they feel like they were part of the decision. And that obviously didn't happen on the Salt Lake City side of it when this started. It was done in secrecy and things like that. I'd just like to also point out that the county, as I understood it, started out to be in charge of programs, not placement.
Yeah.
So that was a city thing, not, at that point at least, not your bailiwick. So Yeah.
Yeah.
The blame would be inappropriate placed on you. And the other question I had about this personal impact on you was, you spent, what was it, 2 months ago now?
It was in late March.
In late March, you spent 2 nights and 2 days.
3 days.
3 days
Yeah.
as a homeless person, sort of undercover. Went out. You didn't do it, as I could see, for political gain, because you didn't make it part of your marketing message or anything. But you were actually out there seeing it. Do you think that this is sort of a no-brainer question, but did that change your perspective or reinforce your perspective on who is being dealt with here, and who was the lawbreakers and who were the victims and things like that?
I think in some ways it both reinforced and changed my perspective. To contextualize this, it was the legislation had tasked me with finding a site by March 30th, and we had done five public hearings at this point, maybe 4 at this point. And I just felt that there was one perspective that was missing from my recommendation that I was tasked with making to the state, and that was going out and seeing this firsthand. And I needed to see the services. I needed to understand from users of the services what worked and what didn't work. And so I was kind of on a whim that I made a decision on a Friday morning that afternoon I was going to go out for the weekend and observe and experience it. And so I did. I left my office here at 5 o'clock on a Friday night and walked downtown and was there until I came back to my office Sunday night. So it was 48 hours, Friday, Saturday, Sunday. Came back to my office about 5 p.m. on Sunday. A few things, I think, first of all, I came out of that, there were a lot of people in the midst of that site selection process telling me that what I should do is just hand this back to the state and say, what would be the consequences of not delivering a recommendation? There would be none. Just hand it back to the state and tell them, you deal with it, I'm done. And after that experience came out saying, we need to do something, that the services right now are not helping people to get better. It's maybe alleviating the short-term suffering, and that's not to be discredited, I think, but giving them a meal and a bed, but we can do better about connecting them to services that are going to help them overcome crisis. And I came out of that experience saying, no, we have to do something. It is that bad down there in Rio Grande. We have to do something, and I'm not going to shirk my responsibility to somebody else, because I felt like if I did, nothing would happen. And something needed to happen. I think the other thing was a little bit of compassion. We say we want people to, why don't they just get a job? Why don't they just deal with it themselves? And they're lazy, or and there's certainly there probably is some of that. There's probably some substance use that's enabled by a system. But I came away just realizing how much time and energy and calories were spent on just finding my next meal and finding the next place I was going to sleep and thinking about that, that there wasn't a lot of time to go to a job interview or to think about getting some training in that so that I could get a better job. That just some compassion about how hard it is to survive when you have absolutely nothing, and the psychological toll that takes. I do want to, as just a disclaimer, I know that 3 days and 2 nights is only a snapshot, and my depth of understanding is minimal compared to somebody who was actually there, and I knew that I was, a phone call away from a family and a home and health insurance and a bed and a job and a bank account, and all of those things were a phone call away. So, I think I was even buffered, even though I was down there and experiencing, I was buffered from what the normal person down there would be experiencing. But I think I did come away with a conviction that we need to move ahead, that we're on the right path when we say that we need to realign the system to make it easier for people to get help, easier for someone to have the services and treatment and other options that are going to help them to lift themselves out of poverty.
So you would recommend that Speaker Hughes spend 48 hours in Rio Grande?
I wouldn't recommend it to anybody. And I didn't feel safe down there, and I just felt it was something that I needed to do as part of the decision that I was making, and but I wouldn't recommend anybody doing that.
Yeah, I would feel less safe if Speaker Hughes was down there with his boxing gloves on for 48 hours.
He's probably better capable of defending himself than I was. But
yeah. Yes. Well, just to round this out, was there a moment, an experience that was very meaningful to you, perhaps an epiphany, crystallized things, something that happened while you were on the streets that you carry with you now?
Yeah, I think there are a handful of things that I I think about. I will say I think this experience changed me and the way that I approach this. But there are a few that I can think of. I remember meeting a couple, a father and a mother with their young child. They had a child that was 9 years old and had mild autism. And I know a lot about the statistics of homelessness and what the challenges in that. And I know that autism or other health concerns are oftentimes a driver for someone losing a job and losing a home and not being able to afford the stability. And so this person was a statistic, but they became real when I saw a mother and a father trying to care for their child, and the child asking where they're going to stay, and and they weren't sure. They were going to maybe head to the family shelter. The father had been kicked out of the family shelter, I think, for some getting into a fight, and so I'm sure there's some culpability there with the father as well. But a young child. I have a 9-year-old, and I thought of my 9-year-old not knowing where his next meal was coming from or his next bed where he's going to sleep that night, and it again reinforced the urgency that we got to do something. One of the other conclusions that we have is that the system does a really good job of going to the lowest common denominator and helping the homeless. But one of the things that we've been recommending with the new model is there are homeless kids who are very different than the victim of domestic violence, and the needs are different than the person in recovery trying to overcome a substance addiction. The needs are very different, and if we put them all in the same facility, in a one-size-fits-all facility, that's a very inexpensive way of giving people a bed for a day and a meal. But it's not a great way to address the underlying root causes, that we needed to separate these populations a little bit so we can start focusing on their underlying needs. So I think of that experience. I think of others. I constantly being approached with offers for drugs or other things, and some of the public safety we saw. I think just wanting to, it was a cold weekend that weekend, and trying to stay warm and understanding why people will do some of the things they did. I remember looking forward to getting on the Trax train because you might be warm for a few stops and that. And as a member of the public and a utilizer of mass transit, we're oftentimes critical of the homeless who are on the mass transit system and make others feel unsafe. And I understand that perspective as well. But it's complex, and people who are trying to survive and their needs are complex. And I think we can do a better job of helping them to help themselves.
May I ask one more question that is a little more hardcore, and I don't want to get into too many numbers and things, but some critics of the new model have looked at its math and have had questions that, and I can't even recall now how many we're talking about, but 300 or 400 people in a resource center for 3 months to be stabilized, if I remember the new model, and then moved to affordable housing for them. There are questions of, can you cure these addictions and mental illness issues that quickly? Will there be sort of an eddy form at each of these shelters where more people can't be taken in because people are returning into the system because they didn't stay clean and things? And I'm sure, as you know, anyone knows who's have addicts in their family, which seems to be all of us now, know that it's difficult to overcome addiction.
So there are a few questions that people have raised with the math. First, the road home shelter has a capacity of about 1,100 people. And the new shelters are going to be sized anywhere from 200 to 300 people. So we're going to be building 700 beds to replace a facility that currently has 1,100 beds. So there's a math question there. What's going to happen there? The way that we address that, I think, gets to also to your question too about what is a resource center. A shelter, the road home shelter right now, we have people who are there for years, or many, many months, and some people there who are there for even for years. what we're trying to do, it's not that we're really bad at doing math and don't know that 1,100 doesn't equal 700 and what's the problem going to be, but it's really a commitment to say if we provide the services and getting people access to the services and connected to those services, maybe we can get them through the system faster and back on their feet faster. And by doing that, you can actually get by with 700 instead of 1,100. One of my base assumptions about this is that emergency shelter is not a good place to have people, and to just resign ourselves to the fact that our system is going to serve the homeless in an emergency shelter, I think is underwhelming and short-sighted. It's not the new model. I oftentimes analogize it to a healthcare system. If you have a healthcare system and the only place to get treatment in that healthcare system was the emergency room, you went to the emergency room and you stayed there until you were healthy, then that's a really expensive place. And you're going to have doctors who are treating everything from cancer to a broken bone, and it's going to be expensive and it's going to be much less effective. So in the healthcare system, you do have an emergency room, and it's important, but it's an important part of a healthcare system. But ideally, a person never has to go to an emergency room. They may go to a specialist immediately. They'll get into the system and avoid emergency rooms. If they do go in an emergency room, they may be there just for a day, and then they get into a more specialized treatment. So I analogize that to a homeless services system, where I think in many ways right now what we have is only emergency shelter. And we're saying, we need to build bigger emergency shelters to get people in there. And what I'm saying with the new model is, let's not conceive of the emergency shelter as the only entry point and the place where people stay until they go back to a job and housing. Let's think of it as they may enter there, but ideally they're staying there for 30 days. And they're not going to be better after 30 days, but can we get them into a treatment program, maybe get them into stabilized housing, probably some supported housing where there's some, their rent is subsidized for a period of time, get them into housing, get them into treatment, get them into a job program, but also into housing, get them out of shelter as quickly as possible and into these other options where their needs can be addressed more comprehensively and effectively rather than a one-size-fits-all emergency shelter. So if we just do fall back to emergency shelter being the only place we serve people, then the new model is not going to work.
Well, thank you, Mayor Ben McAdams. This has been Salt Lake Speaks from Salt Lake Magazine. I'm Glenn Worchel, the managing editor at Salt Lake Magazine. You can listen to Mayor McAdams' ideas and other things that are going on in our community at saltlakemagazine.com/podcast.